Ever feel like you're just bombarded with all this information about health and social care?
Yeah.
You see the headlines, hear the debates, but what does it all actually mean for you?
Right.
So today we are going to take a deep dive and cut through all of that noise
Yeah.
to bring you the essential insights from, well, from your personalized stack of sources.
Exactly.
We're going to be talking about what this sector really encompasses, the kind of surprising roles within it, and why understanding it matters more than ever.
More than ever before. Yeah.
Get ready for some serious aha moments that might just change how you think about your own health and well-being.
It's fascinating, isn't it, how many people think health and social care is just about hospitals and doctors.
Right.
But I think when we look at your sources, it's so clear that this sector is so much broader, a true ecosystem that's designed to support individuals and communities throughout their lives.
Okay, so let's unpack this. Your sources jump right into defining the landscape. What exactly is health and social care beyond the obvious medical stuff?
Well, I think it's about recognizing that well-being isn't just physical, right?
Right.
Your sources really emphasize the vital role of that social care element supporting individuals and families facing all sorts of challenges. Think things like elderly care, disability support, even navigating those complex family situations that we all face. It's really about creating that safety net that strengthens the entire fabric of society.
Yeah, it's about interconnectedness, right?
Yeah.
That idea that individual well-being is tied to the well-being of the community as a whole.
Exactly. Yeah. And your sources highlight how crucial this integrated approach is. By addressing those diverse needs within communities, from medical to social, we can actually build a much more sustainable support system.
Right.
It's like weaving a tapestry, Each thread, each service contributes to a stronger, more resilient whole.
It sounds like such a vast field with so many moving parts.
Yeah.
Your sources also delve into the various roles within this sector. And it's not just the usual suspects, right?
Right. We're not just talking about doctors and nurses. Your sources reveal a whole army of unsung heroes. Social workers advocating for those vulnerable families, occupational therapists helping people regain their independence, and even, those exciting new roles in digital health.
Digital health, that's definitely an area that is exploding.
For sure.
But regardless of the specific role, it seems like your sources emphasize that empathy and communication are just as vital as technical knowledge.
Absolutely. I mean, these professionals are working with people at their most vulnerable.
Right.
It takes a special kind of person to navigate those situations with both skill and compassion. And I think your sources actually highlight some pretty amazing stories of individuals who've gone above and beyond, demonstrating the profound human impact of this sector.
Speaking of making an impact, before we dive even deeper, we wanted to give a quick shout out to London HeartbeatsZ Academy in the UK.
Oh, absolutely.
They're doing incredible work in educating the next generation of health and social care professionals.
Over 140 healthcare courses they offer.
That's amazing.
It is amazing.
They cover such a wide range of specialties. If you're even remotely interested in exploring this field, whether for personal knowledge or maybe even thinking about a career change, you need to check them out.
For sure.
You can find them on Facebook, Instagram, Spotify, and YouTube. Go ahead and subscribe.
Yep.
They've got tons of free resources, amazing discussions like this one. You don't want to miss out.
Yeah, you really don't.
Now, back to our deep dive.
Yeah.
Your sources also explore the challenges and opportunities within health and social care. Every field has its hurdles, but it seems like this sector is facing some unique pressures. What do you think?
Oh, absolutely. You're right. I think one of the biggest challenges highlighted in your sources is just that growing demand for services. And it's driven by so many factors. The aging population, the rise of those chronic conditions, and that puts such a strain on resources. Raises concerns about the sustainability of the existing systems.
Like a tug of war between rising needs and limited resources. So how are people trying to solve this?
Well, your sources point to several key strategies. One is that push for preventative care. By empowering individuals to take proactive steps towards their health, we can potentially reduce the burden on the system down the line, right?
Right, yeah.
It's about shifting from a reactive approach to a proactive one.
So instead of just treating illnesses, it's about preventing them in the first place.
Exactly.
That makes sense. But what about the people who are already dealing with those chronic conditions?
Well, that's where the shift towards community-based care comes in.
Okay.
Your sources highlight how moving care away from expensive hospital settings and into those local communities can be more cost-effective and often more beneficial for individuals.
So instead of always going to a big impersonal hospital, people can receive care in a setting that's more familiar and accessible.
Exactly.
That sounds good in theory, but how does it actually work?
Well, your sources dive into some fascinating examples. Think about local clinics offering specialized services, support groups providing emotional and practical assistance,
Mm-hmm.
and even things like telehealth programs connecting individuals with healthcare professionals remotely.
Telehealth, there's that digital health element again.
Right.
Technology seems to be playing an increasingly vital role in shaping the future of this sector.
Absolutely. And your sources highlight how this trend is only going to accelerate. I mean, we're talking about AI-powered diagnostics, personalized medicine based on your genetic makeup, even virtual reality being used in therapy.
Wow. It's like something out of a science fiction movie.
I know, right?
But all this cutting-edge technology, it must come with its own set of challenges.
Of course, of course. And one major concern highlighted in your sources is the issue of data privacy and security.
Right.
As healthcare becomes increasingly reliant on technology, ensuring that personal health information is protected is absolutely paramount.
It's a balancing act between harnessing the power of technology
Yeah.
and safeguarding individual rights and privacy.
Right.
So what are the experts saying about navigating this complex landscape?
Well, your sources really emphasize the need for those robust regulations and ethical frameworks to guide the development and implementation of these new technologies. It's about ensuring that innovation benefits everyone without compromising individual privacy or exacerbating existing inequalities.
This is definitely raising some important questions
For sure.
that we're all going to have to grapple with as we move forward.
Absolutely.
Now, before we dive into the next section, let's take a quick pause. We'll be right back to explore more fascinating insights from your personalized stack of sources on health and social care.
Welcome back to our deep dive into health and social care.
We've uncovered some fascinating insights already, but your sources have so much more to offer, so let's just jump right back in. One thing that really struck me is this idea of the social determinants of health. It's a term I've heard before, but your sources really break down how these non-medical factors can have a huge impact on well-being.
It's a crucial concept, and your sources do such a great job of explaining how things like socioeconomic status, education, even your neighborhood can influence your health outcomes. It really challenges that traditional view of health being solely determined by biology or genetics.
So it's acknowledging that health is shaped by a complex web of factors, many of which are outside of an individual's control. That's a pretty powerful realization.
It is, and your sources explore how recognizing these social determinants can actually lead to more effective interventions
Right.
and ultimately a more equitable health system. For example, one source highlights a program that combines affordable housing with on-site healthcare services, and it demonstrates how addressing those social needs can dramatically improve health outcomes.
It's about recognizing that health is not just an individual responsibility,
Right.
but a societal one as well.
Exactly. And that kind of leads us into the role of policy and regulation in shaping the health and social care landscape. Your sources dive into how government policies, funding models, and those ethical guidelines have a profound impact on how care is delivered and accessed.
Ah, yes, the bureaucratic side of things. I have to admit, this isn't always the most thrilling topic.
Right.
But your sources do a great job of explaining why understanding this framework is so crucial.
It's not just about red tape. I mean, these policies directly impact you, the listener, by influencing everything from the cost of medications to the availability of those specialized services in your community.
So knowledge is power, right? Understanding how the system works allows individuals to advocate for themselves and their communities more effectively.
Precisely. And your sources provide some really practical tips on how to navigate the system, from understanding your insurance benefits to finding those local resources that are available. They also highlight the importance of those patient advocacy groups in shaping healthcare policy and driving positive change.
It's inspiring to see how individuals can band together to make their voices heard and influence decisions that impact their health and well-being.
Absolutely. And speaking of making a difference, your sources also delve into those ethical considerations that are paramount in health and social care. And this is especially important as we kind of navigate this rapidly evolving landscape of technology and personalized medicine.
Ethics in healthcare, that's a huge topic.
Yeah.
Where do your sources even begin to unpack this?
They start with that fundamental principle of patient autonomy, the right of individuals to make informed decisions about their own care. And this means respecting their choices even they might differ from what healthcare professionals might recommend.
So it's about recognizing that patients are not passive recipients of care, but
Right.
active participants in their own health journey.
Exactly. And this kind of ties into the importance of informed consent, ensuring that patients fully understand the risks and benefits of any treatment or procedure before making that decision. Your sources highlight how crucial clear communication and trust are in this process.
It's about building a partnership between patients and healthcare providers
Mm-hmm.
based on mutual respect and open dialogue.
Precisely. And your sources also delve into some other ethical dilemmas.
Okay.
Things like balancing individual needs with the needs of the community, allocating those scarce resources fairly, and ensuring that those new technologies are used responsibly and equitably.
These are tough questions with no easy answers.
Mhm.
It sounds like navigating this ethical landscape requires a lot of careful consideration and critical thinking.
It does. And your sources emphasize that these ethical dilemmas aren't meant to be solved in isolation. Healthcare professionals often rely on those interdisciplinary teams, ethics committees, and just open dialogue with colleagues to really make the best possible decisions in those complex situations.
It's about recognizing that we don't have all the answers
Yeah.
and that collaboration and shared decision-making can lead to better outcomes for everyone involved.
Exactly. And speaking of collaboration, your sources also explore that crucial role of teamwork in delivering effective health and social care. They highlight how those interdisciplinary teams, bringing together professionals from various fields, can provide more holistic and coordinated care.
So we're talking about doctors, nurses, social workers, therapists, all working together to address the diverse needs of individuals.
Precisely. And your sources provide some really great examples of how these teams function in real-world settings.
Hmm.
For instance, one source describes a team working with an elderly patient who has recently fallen. And the team includes a physician to address those physical injuries, a physical therapist to help with mobility, and a social worker to assess the home environment and ensure that the patient has adequate support.
It's like assembling a puzzle, with each team member contributing a different piece to create a complete picture of the individual's needs.
That's a great analogy. And your sources emphasize that effective teamwork requires clear communication, mutual respect, and a shared commitment to that patient's well-being.
It's about recognizing that everyone on the team has valuable expertise to offer,
Yeah.
and that working together can lead to better outcomes for patients.
Absolutely. Now, as we kind of broaden our perspective, your sources also encourage us to consider those global perspectives on health and social care. And it's fascinating to see how different countries approach healthcare delivery, shaped by their unique cultural values and economic realities.
That makes sense. Healthcare is such a fundamental aspect of society. It's bound to reflect the values and priorities of different cultures.
Hmm.
What are some of the key takeaways from these global comparisons?
Well, one thing that really stands out in your sources is just the wide variation in healthcare systems around the world.
Right.
Some countries have those universal healthcare systems that guarantee access to care for all citizens,
Mm-hmm.
while others rely more on those private insurance models.
That's a pretty fundamental difference.
Oh, yeah.
What are the pros and cons of each approach?
Well, your sources explore this debate in detail, highlighting both the advantages and challenges of the different models.
Okay.
For example, universal healthcare systems tend to be more equitable, ensure that everyone has access to that basic care regardless of their income. However, they can also face challenges in terms of cost containment and those long wait times for certain procedures.
And what about those private insurance models?
Well, private insurance systems often offer more choice and flexibility, allowing individuals to kind of select plans that best meet their needs.
Mm-hmm.
But they can also lead to disparities in access to care,
Right.
as those who can afford insurance may face significant financial barriers.
It's a complex issue with no easy solutions.
Mm.
but it's fascinating to see how different countries are grappling with these challenges and striving to create healthcare systems that best serve their populations.
It is. And your sources highlight how we can actually learn from each other, sharing best practices and those innovative solutions to improve health and social care globally.
It's about recognizing that we're all in this together
Mm-hmm.
and that collaboration across borders can lead to progress for everyone.
Exactly. Now, shifting our focus back to the individuals working within this sector, your sources highlight the demanding nature of these roles and the importance of supporting the well-being of those healthcare professionals.
This makes sense. These are people who dedicate their lives to caring for others,
Yeah.
often in very challenging and emotionally draining circumstances.
I'm sure.
It's crucial that we support them so they can continue to do this vital work.
Absolutely. And your sources delve into the issue of burnout and compassion fatigue,
Right?
highlighting the toll that these professions can take on individuals. They emphasize the importance of self-care, stress management techniques, and just creating those supportive work environments to prevent burnout and promote resilience.
So it's about recognizing that healthcare professionals are human beings too,
Yeah.
and that they need to take care of themselves in order to effectively care for others.
Precisely. And your sources provide some practical tips on how to build resilience
Saw that.
from setting those healthy boundaries to seeking support from colleagues and supervisors. They also highlight the importance of organizational policies that prioritize staff well-being, such as offering flexible work schedules and providing access to mental health resources.
It's about creating a culture that values the well-being of healthcare professionals.
Yeah.
Not just their productivity.
Exactly. And as we look ahead, your sources point to the growing demand for skilled professionals in the health and social care sector.
This makes sense given the aging population and the increasing complexity of healthcare needs.
Right.
What are some of the most in-demand roles and what skills are needed to thrive in this evolving landscape?
Well, your sources highlight a range of those exciting career paths, from traditional roles like nursing and social work to emerging fields like digital health and telehealth. And they emphasize that regardless of the specific role, certain skills are really essential for success in this sector.
So what are those key skills? Besides the obvious clinical knowledge, what else do aspiring healthcare professionals need to cultivate?
Well, your sources highlight the importance of strong communication skills, both in terms of interacting with patients and collaborating effectively with colleagues. They also emphasize the need for adaptability
Right.
and a willingness to embrace lifelong learning as that healthcare landscape is constantly evolving.
It's about being comfortable with change, being a problem solver, and always seeking to improve your knowledge and skills.
Exactly. And your sources provide some great advice on how to stay ahead of the curve, from pursuing continuing education opportunities to networking with other professionals and staying informed about the latest research and innovations.
It's about being proactive, taking ownership of your professional development, and embracing the challenges and rewards of a career in health and social care.
Precisely. Now, as we approach the final stretch of our deep dive, let's take a moment to recap some of the key insights from your personalized stack of sources. We'll be back shortly to distill those most important takeaways and leave you with a thought-provoking question to ponder.
Welcome back to the final part of our deep dive into health and social care. We've really journeyed through this vast landscape of this sector, unpacking some really complex concepts and exploring the human stories that make it so compelling.
It has been quite a journey. And remember, this entire deep dive has been tailored to you using the sources that you provided.
Exactly. So now let's distill the most important takeaways from your personalized stack of information. What are the key insights that you, our listener, should walk away with?
Well, I think first and foremost, your sources highlight that health and social care is about so much more than just treating illness.
Right.
It's about promoting well-being across that entire lifespan, recognizing that interconnectedness of physical, mental, and social factors.
Right. It's about seeing the whole person, not just the symptoms. And your sources really emphasize how this holistic approach requires a collaborative effort, bringing together those diverse professionals and community resources.
Absolutely. I mean, we've seen how social workers, therapists, community health workers, and countless others play those vital roles in supporting individuals and families. And it's clear that empathy, communication, and cultural sensitivity are just as crucial as that technical expertise in this field.
It's about building trust, understanding individual needs, and providing care that is both compassionate and effective. And speaking of effectiveness, your sources also highlight the importance of staying informed about the latest innovations and advancements in healthcare.
Oh, for sure. Technology is transforming this sector at such an incredible pace. From telemedicine to personalized medicine to those AI-powered diagnostics, the possibilities seem endless. But but your sources also caution against just blindly embracing technology without considering the ethical implications.
Right. It's about finding that balance between harnessing the power of innovation while safeguarding those individual rights, privacy, and equity. And that leads us to the role of policy and regulation. Your sources make it clear that understanding the framework of the healthcare system is crucial for navigating it effectively and advocating for positive change.
Knowledge is power, as they say. By understanding how the system works, individuals can become much more informed healthcare consumers and advocate for policies that promote access, affordability, and that quality care.
And your sources provide some great resources and tips for doing just that. They also highlight the power of that collective action, showing how patient advocacy groups can make a real difference in shaping healthcare policy.
It's inspiring to see how individuals can band together to drive that positive change. Now, as we conclude our deep dive, we want to leave you with a final thought-provoking question to ponder.
A question to spark your curiosity and maybe even inspire further exploration of this fascinating field.
As technology continues to reshape healthcare, how do you envision the future of personalized care? How can we leverage innovation to empower individuals and create a more equitable and compassionate health and social care system?
That's a powerful question to reflect on. As you navigate your own health and well-being journey, remember those insights you've gained from this deep dive.
Stay curious, stay informed, and continue to advocate for a healthier and more compassionate world. Until next time, take care.
Take care.